I think a lot of people really don't know how to manipulate or how to get through the medical system because their family physicians sometimes don't know what to do either. So if somebody's interested in getting treatment here, they often go to the website and we'll get an introduction to the clinic. But the most important thing is communicating with our program coordinators. They know everything about what we do at the clinic, and they'll spend as much time as they need communicating with the patient, finding out what their problem is, what kind of treatment they've already had, and whether they need any diagnostic imaging, whether they should see neurosurgery or orthopedic surgery or naturopath, because they all offer different aspects of treatment. So the program coordinators are the best people to communicate with. They will spend time on the phone talking to patients about these issues, and they also can communicate by email so people can go back and forth. And then once we sort out what the person's actual problem is, then we make recommendations for what they should have, whether they should come and get an MRI or whether they should come and see one of the orthopedic surgeons. It all depends on what the person's problem is, what investigations they've already had, and what their goal is. When people are booked to come to the clinic, the program coordinators have already arranged for what's going to happen. So people will have a time to show up. There's often paperwork that they have to fill out, like questionnaires for the MRI screening to make sure it's safe for them to have an MRI. We have them fill out a medical questionnaire, so we have all that information as well for when the physicians interview them. The clinic is here to really help people, and we try to do everything we can to accommodate things. So when people come, we make them feel comfortable. We have a nice waiting room that has a lot of educational videos so people can sit and learn about a lot of the processes that we do at the clinic while they're waiting for their consult. And then once we've seen people and provided their treatment, we also arrange for follow-up so that we know how people do. Like, our whole goal is to make people satisfied with the treatment they get here. So we're here to make them feel like people listen to them. We provide treatment to figure out what their problem is and to eliminate their pain. So the whole goal of the clinic is to give people a good outcome so they can get back to a normal quality of life.